My name is Nigel Wrangham. I'm an instructor at the University of Oregon in the Substance Abuse Prevention Program. Been teaching here for about 8 years. I also teach substance abuse-related courses at Portland Community College, train with Community Anti-Drug Coalitions of America, and conduct and deliver workshops and seminars around the country for violence prevention and substance abuse prevention, mostly with youth. We're going to talk about community organizing. Community organizing is a really all-encompassing discipline which essentially treats the community almost as a client or a patient, where the average professional in the substance abuse treatment field, prevention field, any public health field can use community organizing to mobilize citizens at the grassroots level to gain power so that they can fight against harmful conditions in their environment that lead to substance abuse, teenage pregnancy, any of the harmful or risky behaviors. So community organizing really is about mobilizing the power that's already there in a community and directing it at the community's problems using the community's strengths. Coalitions are one of the most powerful tools that citizens in our culture can get in order to create healthy, nurturing, sustainable conditions where people can grow. Coalitions help a practice in the sense that they can identify those sectors in the community where problems are, drug abuse, violence, for example, so that a practitioner knows some things about the environment where a client or patient came from. It helps to give a more encompassing picture of that client, that person, than just their own individual story. And advocacy, it's all about addressing the sources of power so that they'll mobilize to create health rather than to keep it from happening. Advocacy is really the tool that coalitions use to accomplish their goal. Any practitioner should have some basic understanding of community organizing, just as they need to have an understanding of an individual assessment or treatment plan or any of the tools that we use to treat patients or clients. All one is doing is using modified versions of those same tools, but to treat and assess the community. Again, it gives a bigger, broader picture. It's like instead of just getting a slice of that person's conditions, one is getting a much broader view of where they come from, the risk factors that they may have encountered, their strengths, and their areas of vulnerability. Most alcohol and drug professionals have to, just to be successful in the field, have some basic knowledge, experience, and comfort with the whole concept of collaborating. We collaborate when we refer patients or clients from one provider to another. We collaborate when we involve the family or other support system folks in a patient's recovery. So collaboration in general is second nature to many, many people in this field. The specific principles of collaboration that are outlined in and discussed in community organizing simply put that vague general understanding into a common language so that different sectors of the community can talk to each other. Law enforcement, treatment providers, faith community. They provide that common language for something that we already know but just don't have language for. The best way for a practitioner to become more familiar with or acquainted with or comfortable with the concepts of collaboration, the tools, the process, would be to take a seminar or a class specifically on community organizing. We go through the various stages of collaboration, the stages of group development, case studies of successful coalitions or even unsuccessful ones and where they may have gone awry and how they righted themselves. And the process of a class is creating a community. It's not a lecture-based didactic form of education. We actually practice the principles as we learn about them. My name is Nigel Wrangham. I'm an instructor at the University of Oregon Substance Abuse Prevention Program. And if you'd like more information on what we're talking about today, just follow the link that you see here on your screen. Thanks.